Hello, you're coming to see me for a slap lesion tear or pain in your shoulder. I'm not sure if you were diagnosed by a doctor with this or if I have just given you this diagnosis. However, we'll move about and I'll describe it a little bit more. A slap lesion tear is a superior labrum tear that goes from the anterior side to the posterior side of the top side of your shoulder. You are probably feeling pain when you move it above your head, like this, or when you rotate it down or up. This can be caused from a few different things. A lot of throwers get this, baseball and softball throwers, because of repetitive trauma to the inside of that shoulder joint that cause the fibers of the labrum or the cartilage that is inside of that joint to become frayed and torn. So when the inside, so this is your shoulder joint, this is the top of your shoulder, this would be your arm, and it's moving around like this. Well, when the inside of the fibers in there are frayed, that can become painful because your body's not used to it, and your body doesn't like when it can't move the way it wants to. So there's a couple different options. One option would be surgery. Surgery can be arthroscopic, where they go in with small needles and they'll go and clean out the area and they'll flatten it out and make it a nice smooth surface. However, the other option would be physical therapy, where we can avoid the surgery and hopefully have some success in decreasing your pain and improving your mobility and function. As far as that goes, one area we can address immediately is the acute phase of healing and trying to decrease the pain. We'll abstain from any sort of aggravating movements, so lifting your arm up overhead, throwing, or lifting heavy loads. That puts a lot of strain on your biceps. Your biceps tendon actually inserts way the heck, or originates all the way up here. And if that joint capsule or that labrum is affected or torn, the biceps tendon can also be aggravated. So we'll try to avoid that. Once pain is manageable and we can do some movements, the main focus will be restoring your mobility. We'll be doing a lot of stretches to try to get back that full range of motion so you can reach way up over high or all the way from over here. That'll be the first phase. Well, that's the most important in order to get you to be moving back independently and moving freely like we're supposed to, especially like your other side. After range of motion is achieved, then we'll start focusing on stability and then strengthening. Stability of your shoulder blade is extremely important for all functions, especially with lifting overhead and then just lifting side to side or trying to throw again, depending on what you like to do. Stability will require a lot of push-up position, whether that's on the ground, on your knees, or against a wall. As long as we're putting weight through that shoulder, the muscles around it will become stronger and more stable. Creating a stable foundation around your shoulder is a very big aspect into decreasing pain, especially throughout movements. Think about building a house on a foundation that has sand underneath of it. It's not going to be stable, it's going to sway, and it's not going to last very long. It's the same thing with your shoulder. We want to create a great stable foundation so that stuff can move inside of it and not have as much pain. After we work on the stability, we'll move into strengthening, gentle strengthening. We can use some free weights, we can use bands. We'll work on all planes of motion, so that would be flexion, extension, so forward and backward, up and down to the side would be abduction, and then down would be adduction, and then rotation. You do this motion a lot more than you would even think, and that is one of the most painful motions when it comes to slap lesions. Again, the biggest part and the most important part of all of this is pain and managing pain. That way we can achieve full function and mobility again. And then we'll progress into what you're not able to do. We'll start looking at if you're not able to throw, if you're not able to look over, reach overhead, especially with weight added to it. That would be the final phase in trying to get you back into what you like to do recreationally. Let's see, what else? Do I have anything else? That would be the condition. That would be the overall emphasis of care, and then we'll start with trying to decrease pain with you and see what kind of aggravating movements that you do have. Thank you.